If we break down aesthetics into the entities that make a pretty smile, it's really all about things like tooth position, gingival levels, tooth contour, tooth form, how the tooth position and gingiva relates to the face, the lips, and that in fact most of our challenges in aesthetic problems are because the teeth and the tissue aren't in the right place. Learning in a very detailed way how to think about tooth position, how to think about tissue levels, how to analyze profiles, how to analyze faces, how to analyze lips, how to think about tooth contour, tooth form, and relate that uniformly back to the patient. So all of those things typically are part of an interdisciplinary team. A lot of times we need an orthodontist, a lot of times we need an oral surgeon, a lot of times we may need a periodontist to move tissue for us. So it's a seminar that really is designed to work well at showing teams how to think about the goals for the patient, and then the options of how do you decide which one of those people might be involved in moving the teeth or moving the tissue to really set the case up for a beautiful result. So really day one is very much about learning to look at faces, learning to really in a detailed way understand tooth position, aesthetics of tooth position, tissue levels. We spend a lot of time on tooth replacement and aesthetics. Getting a great aesthetic result when we're missing anterior teeth is much more challenging than we have them. So we spend a lot of time in that course about implants, single tooth implants, adjacent implants. When do we consider fixed bridges? When do we consider using prosthetic pink porcelain? What materials do we use in some of those cases? So it's a course that weaves the restorative element through it, but it's really about the bigger picture of this is how to look at a person, this is how to look at where their teeth are located, this is how to look at where their tissue's located, this is how to think about correcting those things, and this is how to think about working as an interdisciplinary team to achieve those goals. And how do we do that when we're missing teeth, whether it's one front tooth, two front teeth, all the front teeth. How do we get those achieve the same goals with the teeth not being there? And so that's sort of an overview of what the 2 days is about.